Hello and welcome to our career interview with Dr. Sarah Sonenberg. Joining me today is student Cheyenne Bogus. We will get started. Dr. Sonenberg, if you could tell us about your profession, what your profession is, and a little bit about your journey of how you got to where you are today.
Okay, so to start off, my profession is a physician. Right now I'm in my residency, so my current position is I am a junior physician in training, and I work under more experienced physicians for a couple of years until I finish the program, and then I can practice on my own. In order to get to this spot in my career, I had to, just to backtrack, I majored in a science degree. I went to school and I completed pre-medical requirements. I then applied to medical school, where I attended for 4 years, and then I graduated medical school and went to residency.
So in your current work, tell us what a typical day looks like. And maybe not every day is the same, but what does a typical day look like for you?
Yeah, so there really is no typical day for me right now. But I work as an emergency medicine resident specifically. So, a lot of my time I spent in the emergency department. Usually our shifts are about 12 hours long. So I'll wake up on the earlier side, usually around like 5:30 in the morning, uh, get dressed, get to work at 7. Around 7, I get sign out from the other resident who worked. If I'm picking up in the day, I'll get sign out from the overnight resident. And that's basically where they tell me about every patient that's in our department that we're managing currently so that I can assume care of them, because it's a shift-based position. So I get my sign out. I try to see as many of the current patients as I can before new patients start coming in. And then basically it's just like a 12-hour whirlwind of managing patients, seeing new patients, discharging or admitting my other patients, doing procedures. It's just a very busy shift. And then 12 hours later, I sign out to the night resident and do it again in a nutshell.
What do you love most about your job?
I love there's a lot of things I love about my job. I love that it's like very interesting. I love that there's a ton of variety. I see people of all ages. I see any, babies to like the elderly patients, just a variety of different medical problems. So every day is completely different. It's never boring. I love being able to help people with their medical problems and their social problems. And, it's a uh, really rewarding job.
Um, what kind of skills are like needed for this job? So like soft skills like communication or problem solving or trainable skills.
I think almost like any type of skill that you could kind of like check off could be applied. Especially, I think, especially in the emergency department, you need to have good communication skills. You need to be able to talk to your patients, explain to them what's going on in terms that they can understand. You need to be able to communicate with your nursing staff and the other ancillary staff in the department. So I think communication is super important. Um, you know, as far as technical skills, we basically spend our residency learning our technical skills as well. So, we're training in residency for 3 years, and a large portion of that is basically getting certified in different bedside procedures. So we do wound repairs, like stitches. We do splints for if you like fracture your ankle. If you pop out your shoulder, we learn how to pop it back into place. We learn more critical care procedures as well, like we do, with COVID on the news and everything. You hear about ventilators and people being put on those. So we're the ones responsible for doing the intubations in the emergency department, getting critical IV access. So there's actually a very wide breadth of trainable skills that we have to acquire during our training, and that's another perk of the job to me. It's because I like the the thinking and aspect, like the trying to figure out what's going on, but I also like being at the bedside and doing stuff and seeing an improvement.
Are there any skills that now that you're doing this work surprise you that you use them as much as you do, as opposed to when you were maybe younger thinking about being a doctor?
Like, which, you mean specific to skills that you
Yeah,
need?
do you feel like, oh my gosh, I have to do so much more communication than I thought I was going to have to, or more collaboration than you thought you would have to, or you kind of knew going into it, this is a broad requirement of skill sets that I'm going to have to work on?
Yeah, so I think it's tough to say, because when I first started this whole journey of like wanting to be a physician, back in like late middle school, early high school, that's what I wanted to do. And at that point in time, you kind of have a different perception of what the field is than what the realities are. So I think looking back when I was younger in like middle school and high school, I didn't realize how collaborative the field is. Like in my mind, it was like, you become a doctor and you set up, and you're the boss, and you're making the decisions and you're the one running the show. But in reality, you're relying on everyone around you, and everyone plays like such an important role, and you really have to be like cognizant and appreciative and be able to you know communicate that with the people that you're working with, so that everyone's on the same page and you can do what's best for your patient.
So what would you say are some of the challenges that you face?
I mean, it's a challenging job. It's a challenge. It's challenging to even, I'd say, to get to the job too. You know, kind of backtracking, because I know I sort of talked about my journey in kind of a backward sense, but because everything builds on it, on the thing you did before. So in college, like, the pre-medical courses, they're difficult and they're competitive, and getting into the medical school was challenging and competitive, and you have to study for, the MCAT, which is like the kind of like the SATs for medical school. So you have to study for that exam. You have to do well. You have to apply and get interviews, and it's competitive to get into a school. Then the 4 years of medical school are, they are all very challenging. And then you graduate medical school, and then you're in a very challenging job where, not only in the fact that, what you have to do is difficult, but also you have to, deal with difficult situations. You're a lot of times in very uncomfortable positions that most normal people in their job are not in. And you have to get more comfortable with that. Like, you're in the emergency department, we're there on the worst days of people's lives, or the end of people's lives. And that's something that's, to me, like a whole separate challenge than just like, being able to get through schools and getting into programs and passing tests. Like that's, a different type of challenge that you have to be ready to face.
Cheyenne, I'll let you ask your next question.
Would you say that there's opportunities in like your field of profession to move up in salary or positions?
Oh yeah, definitely. Like as a resident, you're still kind of like a junior doctor in training. So once you finish residency and you're practicing under your own medical license, your salary like dramatically increases. And then from there, kind of depending on the longer you're, working for a group for, you can, I assume you get promotions. I'm not to that point yet. But there's always ways to go move higher if you're interested in like working for hospital administration. Sometimes people become like the medical directors of the emergency department. One aspect that I'm interested in is like EMS and like pre-medical care. So I know that there's fellowship opportunities for us as well. So we could, take a pathway, take a year to learn more about the EMS world, and then eventually become like a medical director of like an EMS company or a Mercy flight, which I think is pretty cool.
One last question. Were there any classes that you took in middle school or high school that helped you on your way to where you are right now?
Oh man, I'd have to say Mr. H's science class in 8th grade, which really honestly like turned me on to my love for science. I I think that definitely made a huge impact. And then going forward through high school, I think my biology class very helpful, chemistry, and I guess like you take like the calculus classes too, because those are going to help you when you go to college and have to take the pre-med courses. The pre-med courses are going to be your biology, it's going to be your chemistry, your organic chemistry, physics, calculus, or some advanced math classes. So having a strong foundation in middle school and high school going into college is very helpful for that. And it's kind of tough because I feel like physician as a career is so broad too. So it's kind of hard to talk about just being a physician in general and then also talking about being specifically emergency medicine. So, what I want to get across also is that a physician is like a very like it's a broad entryway into like a vast medical field. So there's so many different specialties, subspecialties that you can go into, and so I know I talk about emergency medicine. That's just one branch, so you don't have to choose that right now. If you're just interested in being a physician in general, there's just a lot of different ways that career can go for you.
It's nice to hear that 8th grade science has stuck with you, so thank you. That's nice to hear.
Yes.
Just a follow-up question for you. So how long does your residency last for? When will you finish that?
So I'm actually halfway through my residency now. So for emergency medicine, our residency is 3 years long. If you do a surgical residency, it can be anywhere from 5 to 7 years. Medicine, if you go into like a general medicine, it's like about 3 years. And then after, you pick a residency or you finish a residency, most residencies have fellowship opportunities, which is how you then specialize in something. So just to kind of give an example, because it is kind of confusing how to navigate through a career in the medical field. So you do medical school for 4 years, then you do your residency, and you pick something that's either like just a medicine, which is just a broad, you work as a hospitalist, like you take care of patients at a hospital and in like a general clinic. So you could do a surgical residency, where if you've watched Grey's Anatomy, you know what that is. And there's some other subspecialties that you can pick as a residency. But then, people who say that they want to become like a cardiologist or something like that. So that's a cardiology fellowship is what you would do after you finish your residency. So that would be a 3-year fellowship on top of a 3-year residency. So just to kind of give you a sense of like how to navigate through a career. So, if you have a specific interest, you can kind of find someone who is in the specialty that you are interested in, maybe try to shadow them, and then ask them like, how did you get to where you are right now? Like, how did you become like a cardiothoracic surgeon? Because their path is going to be different than the person who became a pediatric neurologist. So, it's so vast.
Well, we're coming to the end of our time. So Dr. Sonenberg, is there anything else you would like to share with the students that will be watching this that we didn't get to?
I think one other thing that I wanted to talk about is that as far as like professions in the medical field, it's really important to keep an open mind. I think kind of going into this, I didn't have a strong appreciation for kind of all the other possibilities of careers in the medical field that center on medicine or patient care. So if you're interested in the medical field in general, try not to just anchor on one thing. Like, you know, you don't have to be the doctor. Like there's so many other really cool, really important jobs in the medical field that you should consider and try to get some experience or just some knowledge about. You know, don't have tunnel vision. Like just keep an open mind. Like, you know, you could be a PA, like a physician assistant, nurse practitioner. You could be a critical care nurse. You can be a physical therapist, occupational therapist, speech and language pathologist. Like there's nutritionist. Like there's so many like careers that center around patient care and the medical field, and just, you know, try to consider everything.
Great.
Yeah.
Well, Dr. Sonenberg, thank you so much for your time. This is great information. I know you're early on in your career, so I wish you the best of luck as you continue to navigate that path and find your way. So thank you so much for your time.
Yeah, absolutely. Thank you for having me. I appreciate it. All right.